Welcome back to the channel. Today we focus on prenatal leave as well as the provisions applicable to maternity leave. So let's jump straight into it. In terms of prenatal leave, note that these provisions are effective from the 1st of January 2013 only. A pregnant employee will be entitled to 8 working days prenatal leave per pregnancy, allowing the employee to attend medical examinations by a medical practitioner or midwife and tests related to the pregnancy. An employee can utilize a full day or part of a day for prenatal leave. The head of department shall maintain a system to record such episodes where the employee utilized part of a day. 1 day's prenatal leave shall be deducted once the duration of absences equates the employee's prescribed daily working hours. An application for prenatal leave should be supported by reasonable proof that the employee attended a doctor's appointment and/or went for tests related to the pregnancy. An employee who has used all her prenatal leave may, subject to the approval of the head of department, apply to use available annual leave and/or unpaid leave. Absences related to medical complications during the pregnancy will be covered by sick leave. All other maternity leave provisions as defined in this determination and directive on leave of absence remain applicable. So let's have a look at the provisions relating to maternity leave. Employees are entitled to 4 consecutive calendar months maternity leave to commence at any time from 4 weeks before the expected date of birth or on a date from which the attending medical practitioner certifies that it is necessary for the employee's health or that of the unborn child. It is preferable that an employee commences a maternity leave at least 2 weeks prior to the expected date of birth. However, the service delivery requirements of a particular sector may require different arrangements with regard to the period and stage at which maternity leave, with due consideration of the employee and an unborn child's health and safety, should commence. For at least 6 weeks after the birth, no employee may commence with normal official duty unless the attending practitioner certifies that the employee is fit to do so. Maternity leave may only be interrupted if the baby is born prematurely and is hospitalized during maternity leave, or the baby becomes ill and is hospitalized for a period longer than a month during the maternity leave. The provisions referred to are only applicable to an employee who chooses to interrupt her maternity leave in these circumstances. If an employee referred to under these circumstances chooses to interrupt her maternity leave and fail to return to work after the 6 weeks mentioned earlier, such a period may be covered with annual leave or unpaid leave if she does not have enough annual leave available. Maternity leave may be extended on application by the granting of sick leave as a result of a medical complication and the granting of up to 184 calendar days unpaid leave or the granting of annual leave. Employees who during the 3rd trimester of their pregnancy experience a miscarriage, stillbirth or termination of the pregnancy on medical grounds shall be eligible for 6 consecutive weeks maternity leave, whereafter sick leave shall apply in the event of a medical complication. The provisions referred to shall also apply to an employee who experiences a miscarriage, stillbirth or termination of pregnancy on medical grounds after the commencement of maternity leave. The period prior to miscarriage, stillbirth or termination of pregnancy shall be regarded as special leave with full pay. This brings us to the end of this video. If you found this information useful, please press the like button. We also ask that you subscribe to this channel by pressing the subscribe button as well as pressing the notification bell so that you are alerted when new videos are loaded. Until next time, goodbye.